Certainly. Here's a more in-depth look at schizophrenia, covering its history, symptoms, diagnosis, treatment options, and more. Early understanding. The term schizophrenia was coined in 1908 by Swiss psychiatrist Eugen Bleuler. He used it to describe a split or schizo between thought and emotion, emphasizing that the condition was more than just a split personality. Historical misconceptions. Prior to Bleuler, schizophrenia was often misdiagnosed as multiple personality disorder or attributed to moral failings. The understanding of mental illness has evolved significantly with a greater focus on biological, psychological, and social factors. Positive symptoms. Hallucinations. The most common type is auditory hallucinations, where individuals hear voices that may comment on their actions or provide commands. Visual or tactile hallucinations can also occur. Delusions. Paranoid delusions, the belief that one is being persecuted, and grandiose delusions, the belief in having extraordinary powers or importance, are common. Disorganized thinking, speech may become tangential, incoherent, or nonsensical. This can affect a person's ability to communicate effectively. Negative symptoms. Affective flattening. Individuals may show little facial expression, diminished eye contact, and a monotone voice. Anhedonia, loss of interest in activities that were previously enjoyable, impacting social interactions and personal hobbies. Avolition, difficulty in initiating and sustaining voluntary activities such as personal hygiene or work. Cognitive symptoms, impaired attention and memory, difficulty focusing, sustaining attention or recalling information. Executive dysfunction, challenges in planning, organizing, and making decisions can hinder daily functioning. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or DSM-5, outlines specific criteria for diagnosing schizophrenia. These include the presence of 2 or more core symptoms for a significant portion of 1 month, with some degree of disturbance lasting at least 6 months. It's also crucial to exclude other conditions. Symptoms must not be attributable to other mental health disorders, substance use, or medical conditions. Clinical interviews, whether structured or semi-structured, are conducted by trained professionals. Additionally, rating scales like the Positive and Negative Syndrome Scale, or PANSS, help quantify symptom severity. When it comes to causes and risk factors, genetic factors play a significant role. The risk of developing schizophrenia is notably higher among first-degree relatives, such as parents and siblings. Genetic studies have identified various genetic markers associated with increased risk, although no single gene has been pinpointed. On the biological front, neurotransmitter imbalances are thought to play a key role. Dysregulation of dopamine with hyperactivity in certain pathways and glutamate with underactivity are implicated. Neuroimaging studies have shown abnormalities, such as enlarged ventricles and reduced gray matter in specific brain regions. Environmental factors are also important to consider. Prenatal factors, including exposure to infections, malnutrition, or stress during pregnancy, can increase the risk of developing schizophrenia. Psychosocial stressors, such as life events, trauma, or chronic stress, can trigger or exacerbate symptoms. Treatment options for schizophrenia include medications, primarily antipsychotics, which are used to manage symptoms. These medications are classified into 2 categories. First, we have typical antipsychotics, which are older medications like haloperidol that primarily target dopamine receptors. It's important to note that they can have significant side effects, including extrapyramidal symptoms, which are movement disorders. Then there are atypical antipsychotics, which are newer medications such as risperidone and clozapine. These target multiple neurotransmitter systems and tend to have a more favorable side effect profile. However, they can still cause metabolic issues. Psychotherapy is another crucial component of treatment. Cognitive behavioral therapy, or CBT, helps individuals challenge and modify distorted thinking and improve coping strategies. Family therapy involves family members in the therapeutic process to improve communication and support. Rehabilitation is also essential. Social skills. Training aids in improving interpersonal skills and functioning in social settings. Vocational rehabilitation includes programs designed to help individuals find and maintain employment. Support services are vital for ongoing management. Community support includes peer support groups, case management, and crisis intervention services. When it comes to prognosis and recovery, the course of schizophrenia varies widely. Some individuals may experience episodic symptoms, while others may have chronic challenges. Early intervention and ongoing support significantly improve outcomes. With the right treatment and support, many individuals can lead fulfilling lives, engaging in work, education, and social activities. Stigma and social issues surrounding schizophrenia are significant. Media portrayals often perpetuate stigma, associating schizophrenia with violence or danger, which is largely unfounded. This stigmatization can lead to discrimination, social isolation, and reluctance to seek treatment. Current research and future directions are promising. Neurobiological research is exploring genetic markers, neuroimaging, and the biological basis of symptoms. Innovative treatments such as cognitive remediation therapy and psychosocial interventions are continually evolving. Efforts are also underway to develop more tailored treatment approaches based on individual genetic and biological profiles. In conclusion, schizophrenia is a complex disorder that requires a multifaceted treatment approach. With advances in understanding and treatment, there is hope for improved outcomes. Education and awareness can help combat stigma, leading to better support for those affected by this challenging condition. If you or someone you know is struggling with symptoms, reaching out for professional help is essential.